Good afternoon, everyone, and welcome to our virtual health talk. My name is Melissa, and my pronouns are she, her, and hers. On behalf of the Patient Education and Engagement Program here at the University Health Network, I would like to thank you for attending today's session called Pandemic Pride, Promoting Inclusive Healthcare. I would like to take a minute to thank our planning team. First, the Patient Education and Engagement Program, the Patient Learning and Experience Center staff, the Patient Partners Program, and Education Technology and Media Services. Now, a few words about our online format. This session is being recorded and will be available afterwards for viewing with closed captioning at this same YouTube link afterwards. Today we'll have a presentation for approximately 40 minutes, and then we'll open up to the audience to ask questions for the rest of the session. So to submit your questions, we invite you to go to the link on your screen. You can also scan the code using your smartphone's camera or QR code reader app. You can submit questions anytime during the presentation. We just want to quickly thank those who have submitted questions already. It helps us see what people are interested in learning about most. We have tried our best to address these within the presentation, but we'll definitely answer them again during the question and answer period. When you submit your questions, you may notice that it doesn't get posted right away. This is because we're now reviewing questions before they show up for the audience. This will help us make sure that questions won't be repeated. It gives us some time to address new and different questions. It also helps us prepare how to answer the questions before they're posted. We just ask you to please keep a few things in mind before you submit your questions. You can choose to include your name or stay anonymous. Please note that others will be able to see your name if you do include it. Please do not include any personal details about your health or condition in your question. Our health talks are for general health information only, and the speakers are not here to diagnose or provide treatment recommendations. And we'll try our best to answer as many questions as we can during the question and answer period. And lastly, you can also vote for your favorite questions by clicking the thumbs up button. This will help us bring questions closer to the top, and they'll more likely be answered. And if you have any questions about the live streams during the session, you can email us at pfep@uhm.ca or leave a voicemail at 416-603-6290, and a member of our team will get back to you shortly. So just on the topic of technology, we realize anything can happen when it comes to internet connection. So with that said, should my connection cut out at any point, please have no fear. You'll be seeing one of my awesome colleagues step in to facilitate the session. And lastly, excuse me, we would love to hear your feedback about this presentation. Your feedback will help us know what you found helpful, how we can improve our sessions moving forward, and what topics you would like to see in the future. Please go to the link on your screen and complete this survey at the end of the session, or you can scan the code using your smartphone's camera or QR code reader app, and it'll take you straight to the survey. Now, moving on to our presenters. So first we have Mateo Peralta, who hails from the jagged peaks of Bogota, Colombia, and grew up in Ottawa, Ontario, where he studied journalism. Mateo currently lives in Toronto and works for a Canadian education technology company, where he helps students and educators connect with employers. In his spare time, Mateo is an avid bookworm, collage artist, runner, and writer of short stories. His favorite color is red, which also happens to be his favorite Taylor Swift album. Next, we have Kirsten Engelbrecht, who is a registered vascular technologist with the American Registry for Diagnostic Medical Sonography and has been with Toronto General Hospital's non-invasive vascular laboratory since 2014. She is a graduate of the University of Michigan with a Bachelor of Science in Kinesiology and received her Master's of Education from Wayne State University. She has also served as co-chair of UHN's 2S LGBTQIA+ steering committee for the past 3 years. We'll also hear from Jason Dixon, who joined UHN in 2004 in the admitting department and then transitioned to the Toronto Western Hospital's emergency department later that year, where he has held various clerical positions and currently is the administrative support supervisor for the emergency department and admitting at the Toronto Western Hospital. And we'll also hear from Ruby Shankar, who comes to bioethics as a physician with prior practice in general surgery and community medicine in India and the United Arab Emirates. After post-graduation from the University of Toronto, She joined UHN in 2016 as the bioethicist for Toronto General Hospital. Ruby is currently the bioethicist for Toronto Rehab and Women's College Hospital and a bioethics course director at the University of Toronto. So we have a great group of speakers with us today. And before we get started, I would like to take a moment to acknowledge the sacred land on which the University Health Network operates. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. In particular, we acknowledge that we're on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island. We are grateful to have the opportunity to work and learn on this territory. For me personally, as we talk about inclusion, intersectionality, and anti-oppression over the next hour, I will also reflect on how we can foster safe healthcare experiences for Indigenous peoples. What can we do to build relationships and trust? How can we respectfully engage Indigenous peoples to ensure we're meeting their healthcare needs? These are questions we must ask as we continue to work towards reconciliation. And although we're nearing the end of National Indigenous History Month, the celebration, unlearning, and learning mustn't stop there. These are some of the steps I encourage you to take with me to continue to respect and recognize Indigenous peoples' beliefs, history, and as the original carers of this land. So now I'd like to turn it over to Mateo, who will be starting us off.
Wonderful. Thank you very much, Melissa, for the lovely introduction. So good afternoon, everyone, or good morning, wherever you're watching from. It's really a pleasure to be here, and I'm excited to share a little bit of my story as the UHN patient guest speaker for today. And so you folks know where I'm from, where I grew up, what I studied, and where I'm currently living. So as Melissa mentioned, some of my hobbies include reading, running, and making collage art. There is a piece right there in the second picture. That's an example of some of the work I do. I try to combine the political and the pop culture. But what I'll actually be focusing on today is taking you folks back to 2016, back to the year of the US federal election, back to the year of the Brexit vote, when I was in my third year of university, when I thought that I was the healthiest I'd been in my life. In December 2016, I was diagnosed with acute lymphoblastic leukemia, and I proceeded to enter one of the most emotionally grueling and intense years of my life. So as you'll see, I initially approached it with a bit of disbelief and humor, as my friend documented in that Snapchat, in which I was quoted as saying, "K, as if I got cancer." Like, that's so random. And it was random at the time. But things got very challenging very quickly after that. So as I was managing my treatment, my radiation, my immunotherapy, I was actually in the middle of my first relationship, and I had come out to my family in the midst of it. And at the time, I was seeing a psychiatrist who I didn't fully share these details of my life with, because not only did I feel not the most comfortable, not the most ready, but I also felt like there were more pressing issues that I was dealing with. And there were. At the time, I had lost all sensation in my toes and fingertips due to chemotherapy. I was in a perpetual state of nausea. I had lost almost 30 pounds and had lost all of the muscle mass in my legs. So I could barely walk around my own house without sitting down in exhaustion. And I entered a pretty dark depression and social anxiety. There were moments in which I wasn't sure if I was going to make it, and it was a really dark time. And so while I was receiving support to address my mental health, to address my physical ailments, I never really had the chance to discuss my sexuality with anyone. And in hindsight, I really wish I had, because it would have made a world of a difference. And that takes us to the next slide, to 2019, my year of transformation. So by then, I had been able to kick the cancer into remission. I had managed to go back to school, complete my studies, and I had grown stronger than I ever thought I was ever going to be able to again. And so I had moved to Toronto for my job in education technology, and my new oncologist referred me to a UHN cancer psychiatrist. And there was a bit of friction initially with the psychiatrist, because I would ask them personal questions such as, who is that in that photo, referring to a photo on their wall? What does that ring on your finger represent? What did you do this weekend? And so instead of answering them, they would deflect, which made sense. And so what they ended up doing was kind of trying to get at the root of why I was asking. And so what they asked me was, what is the goal behind these questions? Why are you asking them? What do you really want to know? And so what I really wanted to know was, will you judge me? Can you relate? What can we really discuss in this space? Will you shame me? Is my sexuality trivial in the face of post-cancer recovery? And most importantly, what I wanted to know was, are you a safe person? I was challenged by my psychiatrist. I experienced disagreements, and through that, I was able to identify my discomfort, my closet, if you will, and I was able to deconstruct it. And so this ended up making room for us to discuss really topical and important issues that I was facing, such as my sense of isolation from queer communities during the pandemic. And this helped me become more self-aware. This helped me become more confident, to the point that I was able to run a Pride lunch and learn session at my workplace. And I've been comfortable to speak with all of you folks today. And so while my experience happened in the context of psychosocial oncology, um, I believe that there are a few points that can really be applied in any setting with any patient who identifies as a member of the 2S LGBTQIA plus community. And those are to not dismiss the gender identity or sexuality of your patients as if they're insignificant. Simultaneously, to not treat a patient as if their gender identity or sexuality is all that defines them. To ask questions and not assume, and to not shy away from the personal or from the discomfort, because that's where the learning happens. And finally, if you don't know the answer to something, if you're not aware of what the resources are, what the up-to-date information is, you can refer folks to other resources. And an example that I mention here is UHN's new sexual and gender diversity in cancer care website, which also includes a fantastic community resource guide of over 100 curated organizations that not only support folks in the 2S LGBTQIA plus community, but also their chosen family. And so I feel that there's a lot of power in touching upon those steps that I shared. And I wanted to wrap up with sharing this beautiful quote from one of my own personal role models, Michelle Obama, which I feel really captures that. In sharing my story, I hope to help create space for other stories and other voices, to widen the pathway for who belongs and why. There's power in allowing yourself to be known and heard, in owning your unique story, in using your authentic voice. And there is grace in being willing to know and hear others. This, for me, is how we become. Thank you.
Thank you so much, Matea. And I think it's safe to say you definitely did that today. So thank you, because I know just hearing your experience over the last few minutes has really, I'm sure, inspired other patients to tell their story, but also have healthcare providers reflect on their practice as well. So thank you so much for sharing that with us today. So now we'll move on to the rest of our presentation. Next, we'll hear from Kirsten, Jason, and Ruby, who will share their expertise and experiences around what intersectionality and anti-oppression means, how the COVID-19 pandemic has affected the 2S LGBTQIA+ communities, what role patients and healthcare providers can play to create and foster an inclusive care experience, and resources at UHN and in the community that can help support the 2S LGBTQIA+ populations. Before I hand it over to Ruby, we would like to invite you all to think about this question during the presentation. When you think of an inclusive healthcare experience, what comes to mind? We ask that you please share your responses using our poll feature. So to do so, go to slido.com /UHN Health Talk. So just like how you would to submit a question, and click polls at the top of your screen. You can submit a question anytime throughout the presentation. We just ask that you follow the same guidelines as submitting a question. So you just type your answer here and click send. And to go back to the question and answer part, you could just click the tab at the top here. So thanks everyone. Now over to you, Ruby.
Thank you very much, Melissa. My name is Ruby and my pronouns are she, her, and hers. I'm grateful for the opportunity today to share the space with Matteo, with Kirsten and Jason, as we offer perspectives on what we believe are crucial concepts and ways of thinking to be more inclusive of 2S LGBTQIA+ communities. I just want to, special shout out to Matteo. Thank you so much for positioning us so well for the rest of this hour. We are so grateful for your presence here today and for being willing to share your experiences. And as Melissa was reflecting, not only tells us, relates to the patient experience in many ways, but also the kinds of things that we as healthcare providers need to be very attentive to. So I want to begin first by talking about who I am and why I get to talk to you. I'm a bioethicist and I support patients, families, and clinicians in deliberating what may be morally justifiable going forward for difficult situations or ethical dilemmas for treatment or care decisions. Now, bioethics is a free and confidential service available to everyone in the hospital. As bioethicists, we come from very diverse backgrounds. I'm a physician by first profession, and we bring very different, very diverse professional and personal experiences that inform how we approach and appreciate a spectrum of perspectives for decision-making in healthcare. So bioethics is really about deciding what should be done, explaining why it should be done, and how it should be done. So it's all about the values that we hold so dearly and the ways in which we make decisions to realize our meaningful, wholesome lives. And these values and beliefs, these perspectives that we have are very much influenced by the many identities that we hold. So just like in that image that you can see of the elephant behind a frame and several folks trying to look through each of those frames at the elephant, if none of them knew what an elephant is and you were to ask each of them to describe what they see, they might only be able to describe to you what they can see through the frame in front of them. But putting those pictures, everybody's perspectives together gives us the whole picture, and that's what essentially we do as bioethicists, but what we all do going forward in life with our identities, piecing it together. So in addition to being a bioethicist, the privilege that I have as a bioethicist, as a physician, as being a cisgender person, I'm also a racialized queer woman who didn't grow up in Canada. So the many identities of who I am influence how I am received at work, how I access healthcare for myself and my family. And so this is why it's so important for us all to be involved with creating safe, ethical, and welcome spaces for all of us so that we can all access, we can all work within healthcare, and so that it's important for us to reflect on certain concepts towards that end, which is anti-oppression and intersectionality. So that brings us to the concept of oppression first. So before we go on to talk about oppression, I invite you to join me in mentally walking through three very short stories. These are to highlight assumptions that tend to be made about persons based on how their many identities are received in ways that can affect the quality of their healthcare. All of these that I'm going to be sort of presenting to you are actual patient cases for which I provided bioethics consultations. Of course, all the names have been changed for privacy and confidentiality purposes. The first story. Dr. Faiza Alam is waiting for her turn to be seen at the clinic. A clinician comes to the waiting room and calls out her name. When Faiza begins to get up acknowledging the call, the clinician looks at her from head to toe and speaks in a loud volume. Do you understand English? The assumption here is that Faiza, the patient, has no or limited fluency in English because she's a racialized person and is wearing a hijab. Second story. At the end of a medical appointment, when Tony anxiously asks about birth control, the doctor tells, I cannot prescribe birth control without seeing your girlfriend or your partner. When Tony tries to clarify the birth control is for him, the doctor says without looking up, birth control is for women. The assumption here is that the patient has male reproductive organs because of visible gender expressions of maleness, despite the patient's attempt at clarification. Story number 3. Zach is standing anxiously and quietly outside his mother's room. His mother's very ill and he's feeling very upset. After a while, security comes and asks him to sit down because you're standing here in a threatening manner. The assumption here, there's a threat of violence automatically related to the presence of a tall, racialized man without any indication for violent behaviors. Now, in each of these stories, the healthcare provider made assumptions based on how the patient presented to them visibly or stereotyped them. Each patient faced discrimination based on their identities of race, gender, class, religious beliefs, citizenship, immigrant status. And this is what oppression looks like. Oppression happens when one dominant group is believed to be normal or superior to another group. And it's a concept better understood usually at a systems level of how structures and processes in society are designed to oppress certain kinds of people. So thinking about the historical injustices to several populations across the globe because of colonization as one way. The impacts of oppression are severely experienced at the individual level. The other end of oppression, of course, is privilege, and holding identities of privilege can bring with it power to control or influence change. So going to, when we try to think about power, when you try to think about relations between privilege, identities of privilege and of oppression, it's good to look at this particular image here, this wheel of power, to begin thinking about how they relate to each other. So this is not an exhaustive representation of all categories of power relations, or each of those pie slices. These are not the only kinds of ways to think about power relations, but they're helpful to begin with. There are many other models as well. When we start, for instance, within this, the wheel of power, and we look at one pie slice, take the gender slice, for instance. If you start from the center where power is concentrated and then move away to the circumference, we can see how identities of privilege and oppression fall on a spectrum of experiences, as opposed to just, binary, one or the other. Now, for each of us, our several identities intersect and interlock to produce complex realities and experiences of discrimination or privilege, which is what the image on intersectionality attempts to show us. It's very complex, how it all comes and melts together. So it's not 1 + 1 = 2, but way more complex to how it might look like, right? Now, there are other models that exist as well, just so that we are familiar with them. There's one by Dr. Amy Tan. That's a much more, expanded version of that wheel of power, much more, I like this pretty well, I'll say. The other model that we can look at is the one by Dr. Nixon. It's the COIN model of looking at how privilege and oppression come together systemically. Now, each of these are models to just begin thinking about how anti-oppression and intersectionality come forward, and as an opportunity for us to reflect on our privileges, the ways in which we experience discrimination as well, and to possibly begin imagining how complex the lives of others different from us might really be. Now, intersectional anti-oppression is an approach. So I'll speak about anti-oppression first. It's an approach of the ways in which we recognize oppressions that exist in our society and work to reduce its effects to make society more equal. It's a lifelong process of building relationships based on trust, consistency, and accountability with marginalized individuals and or groups of people. Anti-oppression isn't about saving or fixing people who experience oppressions. Our work and our efforts within anti-oppression, whether we are from the general population or whether we are healthcare providers, must be recognized by the people we seek to ally ourselves with. And it begins by learning to recognize our own identities of privilege and oppression. So then that brings us to what allyship means. What is allyship? What is the practice of allyship? And I specifically mentioned as a practice because it's a lifelong process that we must engage with, practicing acts of support and solidarity with marginalized groups, whether or not we actually belong or identify with that group. That's what the practice of allyship means. It could include participating in movements, social movements, being respectful and listening to marginalized groups, and obviously constantly learning about our own privileges, our oppressions, and challenging our assumptions about ourselves, but also about others. Allyship is not an identity. It's not self-defined, as I mentioned. It needs to be identified by those we're trying to practice allyship for, in solidarity with. So it's not a verb. It's not a noun. It's not an identity. It's a verb, something that we keep doing. And this is an example of what anti-oppression might look like when we're practicing trans allyship as a cisgender person. But essentially, I mean, this is an image I'm leaving here for folks to look at, and perhaps you can look at it later on. But I wanted to highlight very specifically the main elements of practicing anti-oppression, which is first beginning from understanding our own privileges, listening to the experiences of those who are marginalized and how to support them from their perspective. And then the practice of allyship can be seen as three positions or three positionalities. Sometimes we stand beside the person with whom we are practicing allyship to support them in their endeavors, letting them take the lead. Sometimes we have to stand in front of them to protect them from harm that might come to them, and that is with their knowledge, with their permission to be able to do so. And sometimes most of the times, I think we might want to stand behind to allow them to take the lead and go forward, showing us the way so that we can support them with the privileges that we have. So it is really how are our words and actions excluding people from being able to participate as freely as we do or enjoy freedoms as we do? That's the central question that we must have in our minds. And this is the essence when we want to practice allyship from an intersectional anti-oppression approach. With these ideas, I should now hand it over to Kirsten and Jason, who will offer us ways to relate in specific to the oppressions that 2S LGBTQIA plus communities have faced during this pandemic.
Thank you so much, Ruby. And I'd like to just say again, thank you to Mateo for sharing your story with us today. That's just incredibly outstanding and so motivating to hear your story. One of the things we wanted to, just on what Ruby was talking about just now is that as a committee, UHN in our 2S LGBTQ2IA+, we really stand in solidarity with our other panels that are at UHN, including the Indigenous Health Panel, the Pan-Asian Panel, the Black Legacy Committee, and the Accessibility Council. We are here to support them in any way that we can as well, because we are an intersectional group. As the UHN, our committee intersects over all of the committees here at UHN. One of the things that we wanted to talk about, as well as, Mateo, as fantastic and uplifting as your story was, we want to also recognize that not all stories are as positive as the ones that you experienced. And I know that Jason has a story that he would like to share with us in that light.
Hi, everyone. My name's Jason, and my pronouns are he, him, his. And yeah, so thank you, Kirsten. And I'm so excited to be able to share with everyone today. I'm so excited to be here to talk about stories that impact us all as a community. So healthcare providers, we also experience health issues ourselves. And unfortunately, last year, I found myself in the predicament where I needed some services. And one of the tests I needed, and especially is very prevalent within the gay male community, is I needed to have an HIV test because I was having some symptoms that were very similar to someone who might be seroconverting. And when I went back for my follow-up appointment, I went in and I sat with a nurse practitioner, and she informed me that they could not locate my HIV test. And it had been already 2 weeks. And so I was already coming into this with some serious anxiety. If you've ever had to go through an HIV test, it is probably a life-changing moment for you, especially since the impact can be felt for the rest of your life. And it was just very disheartening to have a healthcare provider sit in front of me and say, basically, what do you want us to do about the fact that this test has been lost? And not really understanding the impacts that came with that message. So I'm already sitting with anxiety. I'm already worried about my health. And now I have to worry about the fact that here's someone not understanding why this test is so important to me as a person. And so I think it's just so important that we keep in mind our privileges when we are here to serve the patients and the populations at University Health Network, so that we're not doing them a disservice, because already we have the privilege to serve these people when they're coming in at their worst. And so we really want to make sure that we're connecting with them as basic human beings so that they feel felt, heard, and cared for.
Thank you so much, Jason. That's an incredible story, really. I'm so sorry that you really had to go through that. I think what that really highlights as well is really what this pandemic has done for our community, to our community, I should say. It really has exposed the sort of fault lines in the inequity of healthcare that we get, and to speak to your your frame of mind when, in any other circumstance, regardless of a pandemic, that's going to be a difficult thing to have to deal with and to think about. So already your mental state is somewhat, heightened and a little, you're not in a very good space. And the pandemic has really highlighted that. A lot of with stay-at-home orders, a lot of folks in our community have really lost that opportunity to connect with other people. And there are folks that, with the stay-at-home order, are forced to be in an environment or stay in an environment that is an unhealthy one. Whether they are out to their family, that is one thing, versus if they are out to their family and they are experiencing overt aggression by their family members. And this pandemic has created a situation where they may not necessarily have an outlet or any space to go during that situation. So the mental health, as you can see by these graphics, is just, our community has been really affected by this in some adverse ways. A lot of some people on campuses, college campuses, provide a great area for folks in our community to go to get advice, to go to for mental health. With college campuses being closed, again, that's another resource that has been lost to a lot of people in our community. And some people just, again, don't have anywhere to go. And part of that is a lot of people don't feel safe to come out in their home. And so now they're on campus away, they feel a little bit more open, they have the access, they feel comfortable accessing this healthcare. Now they're at home and they're back, in the closet, so to speak, without access to these provisions. Also, as hospitals, as this pandemic just started growing, we had to, at UHN, we closed a lot of our spaces, made them ready for COVID. So when this happened, a lot of the non-essential surgeries that we provide for people were canceled. So for transgender folks, that meant that a lot of gender-conforming surgeries were now off the table. And again, that is such a huge thing for transgender folks. So for that to now be put on hold, the mental impact that has is one, as a trans, and not as a trans person, I can't fully understand. I can only imagine what impact that has on your mental health. In our older, I won't say older, our adult population in 2S LGBTQIA+, they tend to experience a higher rate of chronic conditions, such as HIV and AIDS, cardiovascular disease, obesity, and they also tend to engage in a little bit more risk behaviors, such as smoking, drug use, and these all increase their vulnerability to getting COVID as well. So now you're in a space where your health conditions are just, at a heightened risk, and has such a much bigger impact on our community than it does on the general population. Our older LGBTQ2IA, this one, 2S LGBTQIA plus folks experience higher rates of isolation as well. So now in a pandemic, when you have a stay-at-home order or you have a work-from-home order, the experience of isolation is even greater. Again, because we have no outlets. A majority of our community is also employed by those companies that are most impacted by COVID as well. We have a higher percentage of people working in those jobs that were really affected by COVID. And I know, Jason, again, you have a story about that as well. Your friends were impacted.
I do. So actually, during the pandemic, as you've mentioned, a lot of our community members work in bars, restaurants, they're performers. And when the pandemic happened, all of this got yanked. And what I think a lot of people don't realize is a lot of these people aren't necessarily working legally. Sometimes they're being paid cash if they're a performer, and now this revenue stream has been lost, and they had no ability to actually apply or obtain CERB in the initial rollout. So a big portion of our community was kind of left in the dark when it came to how are we going to support ourselves moving forward. And it was just something that really other people weren't necessarily thinking about because their jobs weren't getting kind of slashed in the way that these server and performer jobs were being lost left, right, and center.
Thanks, Jason. Where are we to our next one? Sorry, I lost where are we going? Yeah, so again, a lot of these things that we discussed already, the social isolation, so many of the folks in our community are just so much more exposed to these situations. And a lot of times, I think what it is, as it was mentioned before, if you're cisgender, straight population, you don't even think about these things. So it doesn't come to mind, first of all. And something that struck me when you were speaking, Mateo, a lot of times, especially if you have a new provider, so you come in for your healthcare, and now all of a sudden you have a new provider for whatever reason, you have to sort of come out all over again if you feel comfortable to do so. So there's this level of somewhat exhaustion because your entire life almost, there's a series of coming out episodes where you need to let people know, as a gay woman, you get asked the question of using contraceptive, and my answer is always, well, I don't need it. Well, why not? So it's always constantly asking questions. The other side of that coin is that if you're not out, again, it's another thing that mentally and emotionally you have to deal with when you're trying to get that healthcare that is provided to you. So it just creates a very sometimes difficult situation for folks in these communities. And again, we have been disproportionately affected by the jobs, mental health. It's been just a huge impact on our community as a whole.
And Kirsten, I just want to add, if there's one takeaway from today, I'd really like people to remember that our community is aging, and a lot of the community members didn't actually think that they were going to live past the 80s and 90s, and so they haven't really made plans for the future. And obviously this pandemic has put a big wrench in that as well. And what we're seeing is a lot of people, as now they have to transition to long-term care facilities, they're actually going back into the closet because they're now sharing space with people who didn't accept them when they were, growing up and going into adulthood. And now they're kind of being forced to revisit and having to re-examine whether or not they can live openly and freely. And the pandemic has played a huge impact on this because people are losing their ability to sustain affordable housing.
That's a great point, Jason. One of the things I wanted to ask you, as you were experiencing your, when you were a healthcare seeker as opposed to a healthcare provider, when you experienced that, what part about that did you take back into your job? And what do you think would be very impactful for the patients that you see every day based on that experience that you had?
Those are some excellent questions, Kirsten. Thank you so much for them. For me, it was really remembering why we're all here. And that really is for the patient. The patient is why we're all here. And to really focus and listen to their needs and their concerns. Because once a patient opens up to you, it means that they have a level of trust, and you really want to honor that trust and ensure that we're really trying to tailor the needs to the patient and not tailor what we view is the right course. We really do need to be engaging with patients just so that they truly understand what's going on with themselves. And I think that was my biggest takeaway, having to be on the other side, was really being frustrated with people not understanding that I know my body and I understand, for the most part, what I would like to happen.
Great, thank you so much for sharing that, Jason. That's amazing. I think that's it can be a huge life lesson as a healthcare provider to be on the other side of that coin, for sure. I don't know, how much time do we have left, Melissa, before we go on?
We have about 10 minutes left before we get to the question and answer period, but it's a perfect segue to the next part about our poll question.
Perfect.
Yeah. So I guess we had presented the question at the beginning, and we'd now like to review, or Kirsten will help us review the responses. So we had asked you all to think about this question and to provide your responses. So when you think of an inclusive healthcare experience, what comes to mind? So I'm just going to pull up the screen here so you can all see it. Sorry about that. Here you go. So Kirsten, over to you.
Visible signs, buttons, labels of inclusivity. Absolutely. I think one of the big things that as a committee, as a whole, one thing we are trying to do is create that visibility. I think we've had so many discussions around what we can do to be visible. And one of the things is our lanyards, for sure. I was thinking about that today. Even as a gay woman, when I walk around UHN and I see somebody with that lanyard, I'm immediately drawn to that person. And I immediately know that there's an ally in my space. And I want, half the time I want to go and talk to them, but I reserve. But I think that is such a huge thing for staff and patients alike. When they walk into a facility and they see things that represent them, which is why it's so fantastic to have the flag up. The more people we can have that have something visible that says to people, we are welcome, and we will, we recognize who you are. Yes. Again, I think one of the big things in terms of making sure that people have safe spaces, again, especially for patients, I think one of the things that, again, as a committee that we're going to work on is finding out the best way to make sure that patients have that safe space. And I think one of the things that we would like to do is, make sure that we have that visibility, safe space stickers, and we'd like to get that to a majority of where patients go. They're all over the hospital. Any floor that you go to, no matter what your healthcare is, if you can see any signs that there's an ally in, it's going to make patients feel so much more comfortable and not question when they come into the facility whether or not they're going to be taken care of. Because, for me, that's a huge thing. Who come from similar communities. So that's a little more difficult in terms of, if we are wearing something that's visible, that doesn't necessarily mean that you are part of the community. You could be an ally. But I think the same thing. It's difficult as someone that provides healthcare to others. Again, patients do feel comfortable coming out to me because I am wearing that, and they know that they can feel comfortable talking about it. But again, that's not something that you necessarily share with every patient. But someone who knows, then they know that they can talk to me comfortably and safely.
I think, Kirsten, to that same point, if I might add, you're right, it's difficult to be able to create that. But I think when we think about the intersectional approach in that sense, one identity, maybe being a gay woman might be one, but being a racialized person might be another. And so many times, I think as a system, as an organization, as we move towards being more aware of, hiring practices, the way we have structured ourselves as teams, I think that is a point that can be well taken. And I also just wanted to add to all of these points that you're sharing, Kirsten, so well, is that I think it highlights for us, like looking at these responses that people have provided in terms of healthcare experience, it just reinforces for us as healthcare providers, as a healthcare organization, how important it is to have trust, to build that trust, to be able to show that we're trustworthy, not just build trust, but that we can be trusted, that we're doing it consistently, not just because we're having a good day because it's Pride Month, but we're doing it 365 days all the time, and 24/7, and that we're accountable. So when people come forward and say, you're doing all of this, but this is how I felt oppressed, I felt discriminated against, that we're accountable for our actions and that we don't, push it off or defer it to somebody else. This is a systemic, an organizational approach for sure. And I guess what you've been highlighting, Jason and Kirsten, from your stories, from what you have shared, is that as a committee, we're very dedicated to that goal of making sure we support the organization in those efforts towards not just supporting the 2S LGBTQIA plus communities, but the various intersecting identities that this community comes up with, specifically speaking about BIPOC populations. That's the acronym for Black, Indigenous, and People of Color. And as your statistics showed, how very specifically BIPOC populations within the 2S LGBTQIA plus communities have experienced so much more oppressions. Again, it's not like a 1 + 1 = 2. It's so much more complex than that. But when you have more than a few identities of oppression, it's likely that it contributes to much more complex experiences, right?
Thank you so much for that, Ruby. Absolutely. Yes. It's, yeah, I couldn't have said it any better than you did. That was amazing. But yes, as we include everybody, that not only will set the foundation, not just for us, but for everybody. And I think we can lead by example of inclusivity and treating everyone as they come in, as they are. I think that's the biggest lesson, is to just treat everybody as they are and who they are and who they are to you. Ask them those questions, allow them to be who they are. And I think that's just, I'm not sure that the entire world is there at that place yet, but that's what we're aiming for. That's what our goal is, for sure. Thank you so much. Yes, we have, and a lot of these, as if you are staff, you can search these out on the internet, because they are going to be up on our webpage. There's some amazing places that you can go for services, and a lot of the ones that we have here, it's very diverse. As you say, the foster agency. I would just encourage staff, especially, we have an email address that you can send an email to if you have any questions about any of this, if you need any advice on other resources that we haven't listed here, to email that email address. And that's one of the things that we can do as a committee, is find the answer for you. I think a lot of times, Matteo, you mentioned that you moved to Toronto, and it can be very daunting to move from one location to another. And it, again, is like you have to start all over again. I was here and I found these resources. Where am I going to find them here? It can be daunting. So anybody that is staff can access these resources on our website. And again, use our email address if you have any other questions or anything that you feel that any of these resources we are displaying here now doesn't answer your question, because we can certainly do our best to find an answer for you and direct you in the right place. 519 is huge. I think that's coming up next, is just a fantastic place to get information And we as UHN has in the past worked with 519 on education pieces, and they've been a very good place to go for us and supporting us in our endeavors here at UHN.
Maybe this is something I can speak to. So UHN Bioethics is another resource available to patients, families, and staff as well. We're available for consultations to help facilitate, mediate ethical dilemmas. But you know what, if there's a question that's coming to your mind as a patient in your care that you're saying, I don't think this is sitting right with me. I feel odd about this. I don't know how to make a decision. I don't know how to go forward. Or there's conflicting values and thoughts here. We're happy to help you with that process. There's at least one bioethicist at every site at UHN. And if you need more information about this patients, but also staff, please feel free to email me. My email is on the slide, and I'm happy to connect you with folks, colleagues within our department at the site that you need support at.
Thank you so much, Ruby. And if you still can't find what you're looking for, so Kirsten had mentioned the LGBTQ2S committee's email, and we can share that afterwards. But also for the patients watching as well, you're always welcome to contact our UHN patient and family library. So our trained health information specialists can help you find reliable information in the method that you would like, including not just resources, but also community supports. So their contact information is on the screen there if you'd like to reach them. And on behalf of our participants and the patient education program, I just want to take a moment to thank Mateo, Kirsten, Jason, and Ruby for sharing your expertise, but also your experiences about how we can foster a more inclusive healthcare experience for the 2S LGBTQ IA plus communities, but also beyond that, so outside of the walls of the hospital. So thank you for that. So now we'll check our Slido to see what questions have been submitted. You can still submit questions if you haven't already. Sorry, 1 second here. So to submit questions, please go to slido.com and enter UHN Health Talk in the event code, but you can also scan the code that's on your screen now using your smartphone's camera or QR code reader app. So just before we get started, I just want to give a friendly reminder that you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. Do not include any personal details about your health or condition in your question, and we are still reviewing the questions before they're posted just to make sure they're relevant to the topic. And just one final note is that we may also rephrase some of the questions just to help clarify them for the speaker. So we haven't covered your question fully, just email us afterwards and we'll be happy to get more information from you. So for the next 6 minutes, we'll go through as many questions as we can. So starting from the top, someone has actually just provided a nice comment. So that's to Mateo. So thank you for your story. It beautifully illustrated some of the issues faced by sexual and gender minority patients. No question, just thank you. And I echo that. So thank you so much, Mateo. The next question we have is someone or 3 people have voted for this one. What can I do to become or to be a better ally?
Can I take this one on?
For sure. Thanks, Jason.
So I feel like I sit with a lot of privilege. I happen to be a white cisgendered male who belongs to the 2S LGBTQIA plus community. And what I found is the best thing that I can do as an ally is A, leverage my privilege to help bring other people to the table, and B, really holding space, creating space for others who might not have that opportunity to do so that they can have their voices heard as well. I just think it's really important that we can recognize our own privileges and then help leverage that for those who might not experience the same privilege that we do.
Could I add an answer to that as well? So Jason put it wonderfully. Definitely making space for others is pivotal in any form of inclusivity. But I would say that it is also, to be a good ally, it's great to challenge your own perspective by reading about the perspectives of others. If you might not ever kind of be fully aware of what everyone living different lives in the 2S LGBTQIA community might experience, but it's all right to look elsewhere for knowledge. Look for authors, look for writers. Just as an example that I happen to have by my side here, I'm reading this beautiful memoir called We Have Always Been Here, a queer Muslim memoir by Samra Habib. And it is beautiful, and it's really challenging me, because I've grown up not living as I've lived being a white passing Latin American gay man who has benefited from a lot of things. So it's good to kind of read about the experiences of others to help you in taking those steps of being another ally. And that's what I'd recommend.
That is beautiful, Matteo and Jason. Thank you so much for sharing that. That is, I think, the essence of, how do we practice allyship? How do we better ourselves? And I think also the listening part of it, right? The listening to people who are experiencing those oppressions. It's okay to have discomfort. I think that's the first feeling that a lot of folks who begin on this journey feel, and that sometimes stops us from going further into it. But it's okay. That discomfort means that we are unlearning. We're learning new things. And from that kind of discomfort, there's always transformational learning that comes forward. So this is specifically for our staff, people who are wondering, how do I do this? How do I practice allyship with my patient populations who come to see me? Whether it be because of gender, sexuality, whether it be because of race, how do I practice allyship with them? Listen first. Prove that you're trustworthy. It's more than just your words. It's probably even your non-verbal communication that matters a lot in terms of positioning yourself, making someone feel comfortable to be in your presence and share their vulnerabilities. Be in trying to do that, be aware that it is good to share your own vulnerability sometimes as well, to find something similar and hold space. But it shouldn't come across as that you're actually quite privileged, and that it's like first world problems in some ways, if I can say it in that way. We don't want to be crying tears of crocodiles in some ways. So holding space also means, by the way, reserving that space until someone is ready to come and use that space. Sometimes it's not pushing someone into that space because here, I've held it for you, but reserving it for them whenever they're ready, right? And that helps. We are able to do that when we listen to them more and able to understand where they're coming from.
Thank you so much, Ruby, Matteo, and Jason. So I see now it's already 1:57. So I guess for the last question before we close off, someone has asked, how can we get lanyards, and would love to show allyship?
Unfortunately, we have no lanyards left right now, but we are in the process of ordering more. So again, email that LGBTQ address, and we'll let you know when we get more.
Thank you, Kirsten. And I guess for public or those who are not UHN staff, do you have any suggestions on how we can show allyship?
There are places on Church Street that you can buy buttons. There are lots of websites that you can purchase buttons. You can purchase flags. And again, not just necessarily for Pride Month, as we've been speaking, as you spoke to, Ruby, all year round, or a little sticker in your front window. Something like that, a little button on when you do get a lanyard. When you do get it, you can wear that, but otherwise, you can get a flag pin or a rainbow pin and put that on your lanyard as well.
Thank you so much. So now I see that it is 1:58. So unfortunately, we won't be able to get through the remaining questions, but I just wanted to thank everyone for attending today's session and submitting your questions. And just to close off, so I think you may have heard all of us share our pronouns. So if you're wondering why that was, we encourage you to visit this resource to learn more about personal pronouns, why they matter, and how to share them. And I would say this is also a form of creating an inclusive healthcare experience. So please check this out. And finally, if you still have a question for the presenters, and again, I apologize if we weren't able to get to your question today, please email us at pfep@uhn.ca and we'll try to respond within 1 week. And if you have any specific questions for the speakers, we'll be happy to share it with them directly. And next, so your feedback again is important to us. So please go to the link on your screen and complete the survey, or you can scan the code using your smartphone's camera or QR code reader app, and it'll take you to the survey because we really want to know what you found helpful and what you'd like to learn in the future. And to find out about our next talk, subscribe to our MailChimp newsletter and you'll get up-to-date information about events and new resources at UHN. And to subscribe, you just have to fill out the form by going to the link on your screen, or again, scanning the code using your smartphone's camera or QR code reader app. So with that said, thank you so much for attending. And again, thank you to our speakers for sharing their expertise and experiences with us. And we hope to see you at our next talk. Thank you.